Hi guys. Today we're doing another COVID-19 update. This is August 17th, 2020. And today I want to talk about the mother baby unit at our local hospital being a canary in the coal mine. Uh, that is an early indicator of danger warning that we have a problem. Um, I found I follow all the data, the numbers that are coming out for the country, the world, the state, and the county I live in. And there was a statistic that kind of jumped out at me today. And that was the number of positive mothers who are in the mother baby unit. They're in the hospital now. They're delivering their baby. They're going to stay for, on average, 2 days, then go home, assuming they're otherwise well. Uh, but every one of those mothers, regardless of symptoms, gets tested with an RT-PCR test looking for active COVID-19 infection. And as of today, 2 are positive. Now, think about this. We're in New Jersey. We had a huge number of cases early on. In fact, we peaked at almost 4,000 cases, new cases a day during the peak number of cases earlier this year. And yesterday, instead of 4,000, we had 407. So we're down to a tenth of what we had as far as number of new cases. And as far as deaths go, there were 2 deaths yesterday in New Jersey, which is far lower than it was during the peak. So that the numbers are very much lower. That's good. And when you look at the number of active cases in New Jersey, right now they're reporting that we have roughly 20,000 active cases in the entire state. And the population of New Jersey is 9 million people. And that works out to about 1 in every 450 people, or 0.2% of the population, has a confirmed positive RT-PCR test for active COVID infection now. Now, we also know that because of the way who gets tested and that it's only a fraction of the total cases, we estimate that there are approximately 10 times as many cases going on out there than what we have known confirmed. And that would translate out, instead of 0.2% of the population, to be 2% of the population. So figure 1 in 50 people. That's a lot of people running around the state infected. Now, what was interesting was most of these people, like in the whole hospital, there aren't that many cases now. There are only, I think, something like 5 cases total in the hospital, and 2 of them are in the mother baby unit. Well, the mother baby unit is the only one where everyone who comes in there gets tested, and the other units are the ones who came into the hospital because they were sick. And so they got tested because they were sick. Turned out they had COVID-19. So we know about them. So we've got just a handful of acute care patients. There's no one in the ICU now, which is great. No one in the step down, but we got 3 in acute care that are COVID-19 positive, and 2 in mother baby. Now think about that. This is the population that everybody gets tested, so we know who's got it in mother baby. In the rest of the hospital, no, they don't do routine universal testing. So we don't know. So we got people running around all over the place who are presumably positive, who are unknown. Again, that's why it makes sense for everybody to wear masks, because we don't know who these positive people are. They're running around. But again, I thought that was interesting that with just 5 positives in the entire hospital, 2 of them are in mother baby, presumably well, asymptomatic cases, and they would not be known if they didn't get routine universal testing with the RT PCR for active COVID 19. We wouldn't know about them. So I just thought that was interesting. Um, Another thing I did was I said, well, geez, why don't we do more antibody surveys? So I did a search to see what's the status of antibody surveys. And CDC has a really nice article describing the CDC strategy for doing surveys in different locations at different times to get a better handle on how much COVID 19 has been moving through our country. Where, when, all this stuff. And really nice article. But what it doesn't tell is, well, who's doing them? Where are the results of these surveys? I don't know where they are. I looked for them. I could not find them. All I could find was the CDC strategy statement for why they're important and, that they should be done. Just says, well, they're going to be done in different areas at different times. Well, where the heck are they? Where are the results of these surveys? I don't know. If you know, please post a comment. I'd like to see them. Uh, but in any case, I thought, for those people who, like in New Jersey, again, we're patting ourselves on the back, how great a job we're doing. And based on the numbers that I'm seeing, and I do all the calculations, that's 1 in 50 people are running around infected in New Jersey right now while we're patting ourselves on the back, while we're getting ready to reopen schools. What's wrong with this picture? Thanks for watching.